South Korea is battling its worst ever wave of COVID-19 infections. The highest restrictions have been extended in the capital Seoul and beyond. But worrying clusters are emerging in other regions. Experts are blaming public fatigue, slow vaccination rollout, and the Delta variant. How did South Korea go from pandemic success story to country in crisis? Welcome to our COVID-19 special. I'm Monica Jones in Berlin, where case numbers are also rising again, albeit less dramatically so far. It's all a bit like a déjà vu. Strict lockdowns bring case numbers down, the lockdowns end, and numbers are going up again. South Korea is just going through this vicious circle, trying to break it without destroying people's livelihoods and hopes.
South Korea is now battling the fourth wave of the COVID-19 pandemic, with new daily cases hovering over 1,500 for the past 2 weeks. The government extended its highest level restrictions for the capital and expanded limits across the country. Early on in the COVID-19 pandemic, South Korea's strategy of intensive testing, contact tracing, and quarantining drew widespread praise for containing the spread of the virus. But now, as the number of new daily cases reaches record highs here, South Korea's social distancing guidelines, its limited lockdown measures, face growing criticism. 4 rent signs tell the story of small businesses struggling to stay afloat. Myung-jong-man opened a cafe offering a variety of drinks and her own blend of coffee beans, just as the pandemic arrived in early 2020. Soon her business would really feel it.
My cafe is close to Itaewon, so last year's outbreak there affected our sales as well. We hardly saw any customers. It was like a ghost town here.
In Seoul, gatherings of more than 2 people after 6 p.m. are banned. Bars and nightclubs are closed, cafes and restaurants limited in seating and hours. Rule breakers face stiff penalties and fines.
We need to be very careful. We disinfect the store every couple of hours and disinfect tables meticulously after customers leave. We give out hand sanitizer and ask everyone to wear a mask, as well as register with a QR code. For me, as a business owner, I'm not happy about the new rules. But trying to reduce the number of daily confirmed cases by maintaining social distancing is better than more people getting infected.
Meanwhile, some South Korean medical professionals have called for an even stricter lockdown. At Yonsei Severance Hospital, Dr. Lee Hyuk-min oversees COVID-19 testing. He's worried about the Delta variant and the fact that 40% of the new cases are outside of the capital, Seoul.
If this Delta variant starts to spread in the general population, it will encounter other variants and create a new variant. If this continues, the virus would be able to create a variant that resists the vaccines. So we should try our best to prevent Delta from spreading further.
Just around 13% of the South Korean population is fully vaccinated, and officials hope herd immunity will be achieved by November.
For more, I'm joined by June Park. She's a political economist with a focus on public health and data. So very good to have you with us. So we just heard in this report that herd immunity is still a long way off. What are the causes for South Korea's rather sluggish vaccination rollout in comparison?
In the earlier phase of the pandemic, I think South Korea has fared well in terms of quarantine and in the process of social distancing. But the procurement of vaccines, there were a lot to be desired from the public health perspective. And although the vaccines did come through the COVAX facility and through bilateral arrangements and contracts with multinational companies, the rollout itself has been very slow due to the procurement process and delayed schedules.
Okay, and now South Korea is somehow trying to fight this new wave. And in the beginning, certainly, track and trace was a great tool that helped to keep the spread of the virus under control. Why has the virus now spread regardless?
Because the Delta variant, is faster in its spread than any other variant that South Korea has witnessed. The same thing is happening in different parts of the globe. And as we speak, the tracking process is essential to actually defining and identifying where the variant exists. The Delta variant is now close to 50% of the overall cases that are happening in South Korea. It is now the predominant one.
Yeah, like in so many parts of the world, as you mentioned, and like in so many parts of the world, people are somewhat getting angry. They've had enough of all those restrictions. Now, you are a political economist. How will the current weakness in the pandemic response impact the fortunes of the current government there?
So I think in the earlier part of the pandemic, when the first phase of the outbreak in January of 2020, the early response to the pandemic was essential in the general elections held last year. But as we head towards the presidential election next year in March, there is a presidential election planned for March 9th in 2022. And depending on the pandemic governance results, this would hugely impact who would be in power in the next election. So going forward, the questions about vaccine procurement, how to deliver in a timely manner and to satisfy the public's requests, and how to control the variants as they come along would be crucial in determining who would be in power in the next election.
Right. I have one more question, June, because you also have, with your expertise, you could probably help us find, is there a blueprint? Is there a nation that is dealing with a pandemic fairly well, something that perhaps Seoul could copy and paste?
I don't think there is one clear agenda that is fit for all jurisdictions, because the modes of pandemic governance and the political structures, as well as data governance regulations in tracking the virus, what kinds of data to use, are so different across jurisdictions. Some countries have fared better than others, not necessarily because they're democracies, but because they have prioritized public health above everything else. So going forward, what remains to be seen from democracies is how leadership survive and try to survive in the phase of the next phase of the pandemic, as there are new variants, as they are exacerbated, and as public livelihoods economically are aggravated by this terrible pandemic.
Indeed. June Park, political economist with a focus on public health and data. Thank you so much for your time and for your assessment. Now, different nations, different approaches when it comes to fighting the pandemic. And that brings us to one of your questions. Time to ask Derek.
Every country has a different strategy to prioritize vaccines. What does the science say about how to best allocate them?
We're still in the middle of the biggest vaccine drive in history. So evaluating the moving data on this topic is really a pretty tall order. To be honest, I don't even know if, looking back in the years to come, if we'll be able to say anything with certainty about whether countries might have prioritized the right groups for vaccine allocation in the right order. That's because demographics are so different in different countries that making blanket statements about what works best can, I think, provide, at best, just rough guidelines. There are just too many variables. The big problem is that allocating vaccines means making choices that are at odds with each other. The most obvious of those choices is whether to cut down on the death and suffering caused by the disease as quickly as possible by vaccinating the most vulnerable first, or to instead try to vaccinate those who are most exposed. So those who will catch the disease most often and hence really drive further transmission. Countries with aging populations, like many here in Europe, went for the first option. They decided to prioritize the elderly, the group that's most at risk if they contract COVID-19. And that choice seems to be working at preventing death and suffering. A British healthcare authority, for instance, has estimated that the campaign there, which focused on getting elderly the shots first, that it saved over 30,000 hospitalizations and 10,000 lives so far. But that's also left a large segment of the population, younger people, unvaccinated for many months. And of course, as the group that's most regularly exposed, they're now fueling a new outbreak there. So what's the best prioritization strategy? I don't really know if you can put it that way. I'd say that there are just strategies with different outcomes.